Hello and welcome to Planning for Community Change, Chapter 9. Change is on the horizon. Today's lecture will cover health planning at the global level, national level, and community level. There are theories and models associated with the health planning process that assist those involved with the program progression, determining the need and facilitating the change to improve the health of the community. You may find the information in this lecture helpful when writing the Planning of Community Health Promotion portion of the nursing diagnosis paper. Health planning is an organized and systematic process in which problems are identified, priorities are selected, and objectives are set for the development of community health programs based on the findings of community health assessments and health surveillance data. Planning occurs at multiple levels. It occurs at the global, national, state, regional, local, and county level. All of these areas work together to provide health planning that is coordinated and consistent. At the global level, the WHO, or World Health Organization, and the United Nations work with regional agencies to engage in health planning. Recall from our previous lecture, the World Health Organization is a multilateral organization or agency that utilizes both governmental and non-governmental funds to support health planning and promotion. Both agencies have established commissions and goals aimed at reducing environmental pollution, improving living and working conditions, reducing child and maternal mortality, and halting epidemics such as TB. Now we turn our attention to health planning at the national and state levels. At the national level, both Healthy People 2020 and the National Prevention Strategy participate in health planning that is driven by trends in health or health risks identified through surveillance, which has been reported to the CDC. In past lectures, we have discussed Healthy People 2020 goals. Please take the time to review them on page 153 of your Harkness and DeMarco text, as you will need to know them in the future. The National Prevention Strategy, or NPS, was created out of the Affordable Care Act of 2010. At the national level, the organization focuses on the population's health by funding initiatives that prevent disease and promote health. The NPS tasks include 1. Creating healthy and safe community environments. 2. Integrating clinical and community preventative services. 3. Empowering people to make healthy choices. And 4. Eliminating health disparities. At the state level, the Department of Public Health coordinates planning at multiple levels, including the federal, local, or county health departments. The state health planning is based on national objectives, such as those found in Healthy People 2020. You might say this is a coordination of care between the national, state, and local level. Health planning in the community. This is a systematic process that involves all sectors of a community to conduct a comprehensive community health assessment, or CHA. Identify priorities for action, develop and implement a community health improvement plan, otherwise known as CHIP or CHIP, and guide future community decisions and resource allocations. The community health assessment can identify community health problems that are priorities and identify methods to improve the health of at-risk clients. This is very important to remember. The development and implementation of the Community Health Improvement Plan, or CHIP, involves schools, public officials, faith communities, and other sectors of the community. Nurses working in the community settings such as schools, clinics, and home care are actively involved in the planning process. Please take time to review this information and learn the benefits or outcomes of the community assessment. The steps in community health program planning are much like those you have learned in the nursing process. The first step is pre-planning and brainstorming of ideas about healthcare needs of the community. This phase includes going out into the community and establishing trust while obtaining awareness and support of the community. The assessment phase includes collecting data about the target community and its members by completing a needs assessment and assessing available resources. Identifying and prioritizing health needs of the community occurs during the diagnosis. Planning is the development of interventions to meet identified outcomes. Implementation is carrying out the plan and initiating the interventions to achieve a goal. Lastly, evaluation is assessing the strengths and weaknesses of the program and appraising the success or achievement of desired outcomes. Barriers to implementing community health programs. There are some barriers in implementing community health programs, and this information comes from your ATI text on pages 36 and 37. Some of those barriers include inadequate assessment, lack of community partner involvement, impaired communication, inadequate resources, poor planning, and inferior leadership. Working with the community, planning program implementation, advocating for policy change to achieve health promotion outcomes involves the community health nurse actively seeking the participation of community members and institutions as partners for change. How can we enlist partners in the community to make a change? The answer is through the formation of coalitions. Coalitions are a group of health consumers, health professionals, and others working together to improve the community health status. Think of a coalition as a task force set out to achieve a goal. An example is the Greater Cleveland Coalition. The coalition is derived of Cuyahoga County residents who are nonpartisan from multiple faiths who share a common goal of strengthening and improving the quality of life for those living in local communities by advocating for policy change and the expansion of Medicaid for low-income or uninsured clients. A little closer to home is the Stark County Suicide Prevention Coalition. The coalition is a partnership of representatives from more than 20 local community organizations working together to save lives. Active members currently include representatives from community advocacy, behavioral health organizations, survivors of suicide loss, social service organizations, human service agencies, governmental organizations, medical facilities, and educational institutions. To find out more, please go to the hyperlink listed in the notes section of this slide. Stakeholders. Stakeholders are individuals, organizations, or groups that have an interest or a stake in the community health issue or outcome of a community-level intervention. Stakeholders are commonly included in coalitions and are often leaders within the community. The social ecological model. Planning for community change is based on the social ecological model. Within this theory, or model, multiple determinants of health interact at different levels to affect the health status of an individual, population aggregates, and communities. In utilizing the social ecological model, a change in health behaviors in one area causes a change in health in another level of the community. For example, a prescription medication take-back program. Instead of flushing medications down the toilet, they are discarded safely by the client, which contributes to improving environmental health in the community by reducing the risk of contaminating the water source. Again, changing health behaviors in one area leads to changing in another level of the community. Multi-level interventions are needed to achieve change in complex community health conditions. They are designed to address the causes of health problems and the most successful interventions. Interventions directed at different system levels can be described as upstream, mainstream, or downstream. Upstream interventions are directed at societal, environmental, or policy level changes. Mainstream interventions are directed at the population or community level. And downstream interventions are directed at the individual level. Let's take a moment to practice what we've learned so far. The public health nurse researches whether the community would benefit from a monthly stroke screening clinic. Which system level would an intervention address? Would it be mainstream, downstream, sidestream, or upstream interventions? The answer is A, mainstream interventions, because the intervention would be directed at the population or community level as stated in the question. It is not directed at the environment, policy, or individual levels, which would address downstream and upstream. Sidestream is not a concept that we have discussed in this lecture thus far. Continuing on with our discussion on models and theories. Theories of behavior change are embedded in many interventions to bring about change at the community level. Theories are used to promote change in complex systems. One theory developed by Carl Lewin is known as Lewin's model of change. He envisioned change as a three-step process. This information comes from your Harkness and DeMarco text on page 161. Step 1. Unfreezing the status quo, which is a necessary precursor to change. Unfreezing can occur gradually or rapidly. Gradual changes lead to new cultural norms, while rapid unfreezing occurs when there is a sudden awareness or unfreezing from what was the cultural norm. For example, from your book, a child is hit by a car and dies from a head injury related to not wearing a helmet. Now there is this sudden awareness or rapid unfreezing of the previous cultural norm where helmets were not worn. The community is now aware of the need to change, and pre-planning and preparations for change are implemented. Step 2. Changing. The community is dissatisfied with the current conditions or have become aware of the need to change, and so the transition begins. Step 3 is refreezing. This is the process of stabilizing the new health behavior once the change has occurred. The goal is to sustain the changes so that positive health outcomes remain in place, therefore reestablishing that status quo. Support systems are essential to maintain the change and moving towards a new status quo. If support systems are lacking, then the community is more likely to revert back to those old, unhealthy behaviors. This slide depicts another way to envision Lewin's model of change. First, there is a catalyst for change. In the unfreezing, the heat or the flame causing that change, unfreezing. Then the change happens, where we see the melting ice, which leads to forming that new status quo, refreezing, into a new state or a new behavior. Force field analysis. Force field analysis is a change management technique developed by Lewin. The purpose of the force field analysis is to identify the forces driving the change and those resisting it. The diagram on the slide shows the relationship between the change theory and force field analysis. Now, we will talk about the levers of change. The purpose of the levers of change in health planning is to increase the driving forces and to decrease the restraining forces or leverage points that influence change. This information comes from your Harkness and DeMarco text on page 162. Levers of change are tools that make the largest change with the least investment of resources. Public policy levers have been used to reduce smoking by banning it or requiring workplaces and restaurants to become smoke-free, therefore achieving a change in health outcomes that utilizes little, if any resources. Tax increases on alcohol and soda are another examples of levers used to minimize consumption, with the intent on health promotion. The last model that we will discuss in this lecture is the logic model. The logic model for community health program planning is a visual representation of the logic behind the operation of the program. Again, this information coming from page 164 of your textbook. It identifies who or the target population, what is going to be done, when or the timeline or time frame, and where and why, or the program theory. It assists in identifying resources that are either needed or available, plan a timeline for program implementation, develop a budget, and identify a means of evaluation. SMART objectives. Developing a community health program requires the use of SMART objectives. SMART objectives are specific, measurable, achievable, relevant, and time-bound. Program objectives written in the SMART format assist in planning interventions and establishing measurement systems for evaluation. Leaving out just one of these objectives would make it difficult to evaluate the effectiveness of the program. Switching gears a bit, we will discuss funding community-level intervention programs. Planning and implementing community-based health programs requires secured funding. Funds may come from internal budgets, organizations, local businesses, and foundations. Key concepts related to community funding are accountability, sustainability, and program replication. Accountability refers to regularly communicating how funds are utilized, detailing the program's activities and progress toward achieving desired goals. Community nurses will need to be accountable for how the program was implemented. Sustainability refers to how the program will be maintained after the funding runs out. If the resources run out, this could lead to reduced program maintenance. Therefore, those healthy changes are no longer supported. The program could end up going in the wrong direction. Program replication means being able to replicate a successful program within a different community. Our discussion on funding continues. There are different means whereby community planning projects can be funded. Government agencies most often receive grants from the NIH or CDC targeted toward funding specific populations or disease. Program planning. Private funding comes from foundations of all sizes. They provide grants for community health services. An example of private funding is through the Aetna Foundation. Please explore the link to find out more about how the Aetna Foundation provides funding for community health programs. Local project funding comes in the form of support from local businesses and healthcare centers. Having local support demonstrates the engagement of those businesses in that community in making a difference and promotes sustainability in that program. Social marketing. Social marketing is the use of marketing principles and practices to change health behaviors or beliefs, social or cultural norms, or community standards to improve health or benefit society. You may hear or see many ads on billboards, commercials, and the radio. Some radio stations have social marketing that targets a certain demographic. For example, someone who listens to a news radio program may be over the age of 40 and a male. Thus, commercial public service announcements are geared toward that demographic. Some other examples of social marketing include the NFL Play 60 fitness program. With the football season heating up, we will be hearing this on almost every commercial. Another example is the Domestic Violence Awareness Marketing Campaign, aimed at bringing awareness and reducing violence, changing cultural norms. Some of you may recall the commercials played during the Super Bowl where the female was texting a friend and the texts suddenly ended. One could only assume what had happened. On a lighter note, I've shared a YouTube video aimed at bringing awareness to texting and walking, aka distracted walking. This is a light-hearted example of social marketing geared toward promoting health by avoiding injury. Please take time to watch the video. Our last slide provides information on nurse-managed health centers. Nurse-managed health centers are led by advanced practice nurses, or APNs. These centers and nurses provide care and programs to improve health promotion, disease prevention, and health education to vulnerable and underserved populations. They also provide clinical practice opportunities for nursing students such as yourselves and faculty while meeting the needs of specific populations. Please watch the video included in this slide for a better understanding of nurse-managed health centers. It is important to know and understand the characteristics of the nurse-managed health center. This information is included at the end of Chapter 9. This concludes our lecture for today. I hope that you have gained some valuable information that may assist you in writing and planning for your health promotion within the community. Please do not hesitate to see me for any questions or concerns. Thanks, and have a great day.